It's just great to see you, Dr. Sobowale, and congratulations on being granted one of the AIM Clinical Science Fellowships. I have to say, when I met you at UCLA and we were talking about your project, and you got this award, I was just so extraordinarily pleased, because I think your work and what you're proposing to do is so cutting edge, and it really is around like that early intervention of youth mental health, and one of those really feasible ways to address youth mental health early on. And I mean really early on, right? So could you start by telling us a little bit about your project, and then a little bit about your background, and just to help us get to know you?
Sure. So, my project itself focuses on trying to decrease the risk that can come with perinatal mental illness on child development. So specifically, I'm focused on postpartum depression, which affects up to 13% of women annually in the US, over 500,000 women. And what we found over time is that postpartum depression affects child development, in terms of their mental health, their physical health, and also even mortality. So the question's always been, why is that happening? And some of the leading research has found that perhaps it's the mother-child interaction in the postpartum period that's affected, and that leads to some of these outcomes. However, the way we understand that's usually in a lab-based setting, which has its limitations, because families come into the lab and they may not act as their normal selves. They may be a little bit shy. And so we only get little snippets of that interaction. So we want to take it out of the lab into homes and get longer probe of that interaction using sensors. And it's also worth saying that part of the difficulty also comes in, particularly in this COVID era, in going to people's homes and being able to do things like record, which has been done in prior research. So really the hope is to better understand this mother-child interaction in the context of postpartum depression, and ideally do it in a way that's going to be scalable in the future. So that's the project in a nutshell.
So this could actually become used as an intervention, right? If you have, how do you select people for the, like mothers and children for the study?
Yeah, so we have folks who come through the UCLA clinics, OB-GYN, and also we're hoping to add on the ped side too. We get mothers who have elevated or at high risk for postpartum depression. So the biggest risk factor is, having current depression or a history of depression. But we also screen for a lot of other things that increase risks of postpartum depression, like anxiety. So folks who have that are put in this high risk group. And then we also measure their level of depressive symptoms. Then we have a low risk group that doesn't have those risk factors and currently doesn't have depressive symptoms. And so we're going to compare that high risk group with the low risk group. And that's how we get our participants.
And then you will look at the impact of postpartum depression on that infant, and as that infant grows up. That's yeah. And what amazing things we can learn from that, because I can name so many friends and family members who have suffered from postpartum depression, and just knowing ahead of time the impact would be so helpful, even if you're not part of the study. So I think your findings will be replicable and applicable to a very large population of families. So we really appreciate that. So tell us about, how did you come to this? I know with research, we always kind of scratch our heads and think, okay, I'm curious about that, So what in the background of your education and your life made you curious about studying the impact of postpartum depression in a mother on an infant?
Yeah, it's interesting. I've been interested in prevention and early intervention of mental illness for some time. And part of that came out of spending a year actually living in Japan. I was studying Japanese and also a cultural bound illness at the time called hikikomori. And these were folks who were secluded from the outside world. So they were defined as folks who would, usually live in their home space, have minimal interaction with the outside world, and not be engaged in school or work or anything else for at least 6 months to decades on end. And I left that experience being like, how can we reach these folks who are hard to reach and get them, some support, mental health treatment.
Mhm.
So that led to doing some work in medical school that focused on trying to prevent using internet-based interventions to intervene early on youth depression. And over time, I just started to think, oh, well, it's great to intervene in the teen years. I wonder if we intervene earlier and then earlier and then earlier. And
Earlier
so
and
now
earlier.
I'm in
Yeah.
pregnancy and early childhood. So
Mhm.
it's definitely been an evolution. And yeah, I really hope to decrease the burden of mental illness and try to utilize, in my case, digital health technologies to do so.
Mm, great. Oh, thank you so much for sharing with us. And we want to stay in touch and look at how your research is going and what you're learning, because one of the goals that we have at AIM is to really bridge those gaps between what we know, like we're learning like with your study, there'll be information that we know, and then how can we get it to the front lines where people need it. And it seems like not necessarily the probes or the monitors that you're putting on people wouldn't even necessarily have to be had, but to know how to use the results of your research in daily lives of people, and just the knowledge of how mothers and children can mitigate any of those risk factors that would happen in postpartum depression. It's a very interesting study, and I'm going to be cheering you on all the way, because I'm a Bruin, so UCLA, and so we're just really proud of your work. So thank you so much, and I just wish you absolutely the best. And we'll be back in touch with some of our donors and our supporters and other doctors who really want to follow your work. Thank you so much.
Thank you for the support, and I really appreciate the opportunity to be able to continue to build on this research and
Yeah.
at the end help families out. So
Yeah, that's what we're all here for, is really helping those families, helping families become better. Yeah. So, all right. Thank you and good luck.